There are so many questions and concerns and discussions around the mask. So, to help us clarify everything on this all important topic, we are joined now by Dr. Jennifer Burgess. She is with the family medicine physician with Henry Ford Health System. Thank you so much for being with us on the Oakland County Megacast and taking time out of your Friday to be with us.
Thank you for having me.
Why is this so confusing for people?
Well, as you said, the guidelines have been changing ever since March, and that makes things extremely confusing for everybody. So you're spot on. Back in March, we were really concerned about resources for all of us in healthcare, including even the surgical masks. So to help us conserve, the recommendation was to not wear a mask as we kind of caught up on all of our resources. Evidence and guidelines and science showed that wearing a mask is helpful, and even a cloth mask is better than nothing. So what we're seeing right now is science and evidence in real time, and every day things are changing, which is extremely confusing for even us in healthcare.
So, where we stand today, do you recommend wearing a mask, but not only wearing a mask, what type of mask should people be wearing?
So the current recommendation is for anybody 2 years old or above to wear a mask if that is possible. Um, a, a cloth mask is going to be helpful in preventing transmission. It's not perfect, but it will help keep particles from affecting other people. A surgical mask is also going to be very helpful. N95s are still slightly short-handed, so if possible to conserve those, it would be better to save those for the healthcare professionals. But if you have one, that will also be useful. The valve masks, unfortunately, are not beneficial, as there's a release on the mask that will allow particles to go through, and therefore it defeats the purpose of protecting other people.
Well, I just saw an article too. I think it was some of the casinos, the tribal casinos were saying that if you need a mask, but they were no longer allowing you to come in with a valve mask or the neck gaiters or bandanas. And I will say I'm a big neck gaiter person just because of the convenience of them. So, do you recommend them or do you not recommend them?
I haven't seen anything that says not to use them, so I would say doing something like that is better than wearing nothing. But the valve masks, as I mentioned before, the reason for that is it doesn't protect other people. It protects yourself, but your particles can still be released.
I know when the governor first came out with the mandate, there were some people saying that, hey, for health reasons, I can't wear a mask. And then you were seeing these online, it was basically like a card you could print off. If you Google just, medical reason for not wearing a mask, and there was a little card you could print off to try to show businesses that you had a medical reason for not wearing a mask. Is there a medical reason for not wearing a mask? And if so, how do those people try to explain that to the public and business owners?
There are very few medical reasons for not wearing a mask. As I mentioned before, children under the age of 2 definitely should not be wearing a mask, but anyone 2 and above technically has the ability. However, there may be exceptions to this rule. People who have significant breathing difficulties, such as COPD or CHF, technically they can wear a mask, but if not tolerated, those people especially probably should not be leaving the home. Another population are adults or children who have mental disabilities or other issues such as that. They may have a challenging time keeping the mask on, or sensory processing disorders. But there are ways to also help kids and adults who have phobias get used to the mask, and wearing it at home for short periods of time and extending that time can help them adjust and get used to it. But when in doubt, it's always reasonable to discuss with your physician if this is an option for you if you shouldn't be wearing a mask, but there are really very few exceptions to the rule.
Family medicine physician Dr. Jennifer Burgess with us on the Oakland County MegaCast, joining us from Henry Ford Health System all across the Oakland County area. Dr. Burgess, there's been a lot of myths that have been put out there about wearing masks, the ways it can affect people's health. Oh, it actually makes you more susceptible to COVID-19. What are some of the more common myths that you have heard out in the ether over the course of the pandemic, and how can we go about debunking those myths?
You're exactly right. There are so many myths and how it can affect your health, and oxygen levels dropping or increasing the amount of carbon dioxide, CO2 that you inhale. The bottom line is science and data show that masks do not affect your oxygen level and will not increase your CO2 level. You're still able to expire those chemicals, essentially, to keep your oxygen levels up. And again, the bottom line is it won't increase your susceptibility to COVID-19. It's actually going to prevent you from potentially being exposed or exposing others if you're a carrier that doesn't have symptoms yet.
One of the things I see so much, people who have their mask on, they pull it down, it's under their nose, and even when you talk, a lot of times it will come down, but they wear it on their chin, they put it back up. How many people do you think are walking around and wearing a contaminated mask, and what advice do you have for us to make sure our mask is safe?
And I think that's the challenging thing. If you are touching surfaces and then touching your mask, you're potentially exposing yourself. So a big thing is once it's on, to keep it on, and prior to taking it off, make sure that you're washing your hands. And if this isn't possible, have an extra mask on hand that you can put on if you accidentally touch it or move it down. But you're right, if it's below your nose, you're still unfortunately going to expose others or expose yourself. Cloth masks should be washed at the end of the day. Just toss it in the washing machine. But the big thing, especially right now in general, wash your hands.
So we're talking with Dr. Jennifer Burgess. She's a family medicine physician at Henry Ford Health Systems. I live on the West Bloomfield Trail, and I see a lot of people that are wearing them as they're running. Should you wear a mask when you are exercising outside? And if not, is it okay not to as well?
So if you're exercising outside, that's a better option of social distancing in general. Plus you have the airflow going through. So it's definitely reasonable to run and exercise without a mask, but I would recommend having one on hand in case you are close to someone and unable to keep that 6-foot distance. But in general, it's pretty hard to exercise with a mask on, and it's not recommended if at all possible. Right now, we don't have the gyms open, so that's kind of a non-issue. But if you're outside, really it's reasonable to exercise without a mask. But if you're going to be passing someone just out of courtesy, I would put one on.
Dr. Jennifer Burgess with us, a family medicine physician from Henry Ford Health System, with us on the Oakland County MegaCast. Dr. Burgess, a lot of people have issues with their masks not fitting correctly. They get a certain mask that's just on hand, a blanket kind of general mask at work or at other places that maybe are a little bit loose or are too tight and they're not going to stay on when you're talking. What should people be doing to be able to adjust their masks if they are too tight, or to find a mask that is the right fit for them?
That has been the tricky thing, even buying masks for my own children, is you buy them and then you can't return them. So I would definitely recommend, if you're going to be purchasing a mask, buy one and try it out first. There are lots of options as far as helping with ear pain and discomfort, even if you go to Amazon or on Etsy, that you can wear something to kind of pull the mask off from behind your ears. But once you find a mask that works well, I would buy a bunch of those so that they're on hand and can fit well. If they tie, you can just adjust that way, but the ear loops can be a little bit trickier, but there are things that you can find to help modify that.
I know. So I think this is more of a chick thing, but I like to buy them so that they match. Like I found this cute little one. It has flowers on it at the gas station, but it's like you said, you don't know if they're going to work or they don't. But one of the things I hate is because you mess them up, women, because of our makeup and our lipstick. Someone out there needs to design a mask that doesn't take off our makeup and doesn't take off our lipstick. But one of the other big issues is when you're wearing them and you're trying to read it, your glasses fog up. Is there anything you can do to help prevent that?
Having a good fitting mask against your nose and against your cheeks will help with that as much as possible, just because if it's flat against your cheeks and your nose, that air is not going to flow up. Otherwise, I think that's the other one that would probably make a lot of money, is a mask that would help prevent that glass fogging.
Okay, so I do know people that have been diagnosed with COVID, and some people feel like once they've already had COVID, they don't need to wear a mask anymore. For those people out there, what do you say? Should they still wear one? I mean, now you technically still have to, right, because of a state mandate, but for their own health, do they still need to wear a mask?
The thing that is very frustrating about COVID-19 is there's a lot that we don't know, and there's a lot that we're figuring out day to day, minute by minute. So the problem is, even though somebody has had COVID-19, we don't know if they potentially could get it again. So just because they're antibodies or confirmed disease and now completely asymptomatic, I definitely recommend continuing to wear a mask, at least until we have further science that shows that you will be safe.
Dr. Jennifer Burgess with us on the Oakland County MegaCast. She's with Henry Ford Health System, a family medicine physician. In terms of kids wearing their masks, getting them ready to go back to school. Some are already back in school. You mentioned that children over the age of 2 should be are healthy to wear a mask. What suggestions do you have for parents about properly masking their children? What differences maybe are there between masking yourself and masking a younger child?
So as we talked about with things changing constantly, the World Health Organization recently recommended 5 and above for masks. So something to kind of keep an eye on. Right now, the recommendation is still 2 and above, but keep listening to the latest recommendations. But to help those younger children get used to wearing a mask, I recommend at home practicing and letting the child pick out the mask, put on the mask for short periods of time and gradually extend it. But also it will be very important in the schools to give mask breaks. So situations where the kids can be 6 feet apart and able to take the mask off and take a quick break and breathe. But the easiest way to prepare your child is this weekend, heading into the school week, is practice.
Yeah, like the principal told us yesterday, Tyler, the mask is the latest fashion accessory for these kids. So get out your bedazzle machine and make them unique. Doctor, I do want to say, like in Asia and China, they've run into this issue prior with other outbreaks. And so they're more accustomed and more accepting of wearing a mask than we are here in America. Do you think this is something that in the United States we're going to have to continue to utilize a mask post-COVID? Are we really going to have a completely post-COVID?
That's something that we definitely don't know yet. But as we're getting more vaccines that are in clinical trials right now, there's potentially hope once we're able to vaccinate our population that we won't necessarily need to utilize the masks. But we're still, at least 6 to 12 months out from those trials being completed. So hopefully once we have that and there's more widespread use of the vaccine, we can talk about back in the day when we had to wear the masks. it's also going to be helpful during flu season. So it'll be interesting to see once we have the COVID vaccine, if this just becomes routine during flu, cold, COVID season in general. So time will tell.
Time will tell on so many things. Dr. Jennifer Burgess with the Henry Ford Health System, thank you so much for taking time out of your Friday schedule to be with us here on the Oakland County MegaCast. We appreciate your time and sharing your information and your wisdom and your knowledge with all of our listeners and viewers here on the Oakland County MegaCast.
It's my pleasure. Thanks for having me.